Hey, Dr. Tyler Williams at Better Sleep SLC, and thanks for being here to watch this video today. We're excited to share with you some insight on dental sleep devices and what they are and what they are not, and some new options you may not be aware of, ways that you can hopefully start getting some help today or soon to sleep better, feel better. It really starts with what we call the 10 years younger approach. And this is where we work on treating you in a way that not only stops the episodes you're having where you stop breathing or you snore at night, but also to help you feel younger, feel your best, do the things you want to do, stay active, and have a good quality of life. So typically, there are 3 options for treating your sleep apnea. Now, all these options can be supplemented by lifestyle changes, which include diet, exercise, sleeping position, different types of pillows, when you eat, avoiding eating late, types of food you eat, and those kind of things. But specifically, why you're here is because you're trying to figure out which device is best for you. And the truth is, the option that's best for your spouse or your bed partner may not be the best option for you. So some people do well with one and not as well with others. Generally, your 3 options for the treatment aspect of getting your sleep apnea better include surgery, which may include some type of implant that makes your tongue move every time you stop snoring. It can involve jaw surgery, airway surgery, those kind of things. That's usually the least preferable for most people, understandably. So it's the most invasive. So we try to help you avoid surgery, but some people, surgery ends up being the best option or a part of an option. Some people we treat with combination therapy where you might use 1 or 2 different of these 3 options. So surgery is your first option. Your second option is an oral appliance device you wear inside your mouth, and it keeps your tongue and your jaw from falling back, which is why the airway closes off. And there's something called a Mallampati score that we look at when we check your airway, and it shows the size of your airway. And the Mallampati score will give you some insight on seeing just how much your tongue has to move to sometimes block your airway. We give this analogy of putting a plunger in the toilet and then flushing the toilet a bunch and wondering why the water's not getting down. And sometimes it's just that small amount of tongue movement to block that off. And we see that a lot with people who have small jaws, large tongues, little throats, little airways, or you've lost teeth or lost bone in the back of your jaw. It's caused your jaw to shrink, but your tongue stays the same size. Another one we see is people have bumps inside their bottom teeth. You can feel around there. You may have these big bony bumps. They're pretty common. It's called a tori, a T-O-R-I. They're usually harmless for most cases, and but they can cause your tongue to not have as much room and crowd your tongue and cause it to push back a bit. Crowded teeth, if your teeth are tipped or tilted back, that can cause your tongue to be pushed back. So all these things can be generally treated with the oral appliance for your sleep. Sometimes we'll also straighten or move your teeth out as well, so there's more room for your tongue. And that can be a great way. And the oral appliance is typically the easiest for people to wear, the easiest to get used to, and the most preferable for a lot of people. Again, it doesn't work with everybody, but for people who we treat, we're usually successful with 9 out of 10 people. So we have a specific screening process that we go through to see if you're a candidate or not. And then your third one is CPAP. It's been around the longest. It has a proven track record. It works well. Probably half of people who get a CPAP can't wear it or don't wear it regularly because they feel claustrophobic, or when they turn, it pulls the mask off. But for the other half who wear them, they tend to do really, really well, and it works nice. Now, sometimes a combination may be possible where maybe you'll have surgery of your jaw and wear a CPAP, or maybe you get an oral appliance and it doesn't work quite as well as we want, so you have to go back to CPAP, but now you can turn the pressure down. One of the reasons people don't wear CPAP is they feel pressure leaking outside their mask, and it disturbs them or annoys them. And so you can wear an oral appliance, and sometimes we can turn that pressure down to half in your CPAP. So it's just a more gentle, calm pressure. because by wearing that appliance, it keeps your jaw forward. So best thing to do is meet with a sleep team. If you're interested in the oral appliance, you want to find a dentist who is trained in dental sleep medicine. Our clinic, for example, is set up as a medical clinic, not a dental clinic, for a couple of reasons. One is we only treat sleep disorders in this clinic. And the other one is so that if you have Medicare or medical insurance or you want to bill your insurance, we can use that. Dental insurance does not cover oral sleep appliances because we're treating a medical condition, not a tooth condition. And so it has to be billed through your medical insurance. And when I started doing this and I only had a dental practice, I could not bill medical insurance very effectively. So with a medical only practice, we have the great opportunity to be able to utilize your medical benefits. So if you'd like some more information on this or a copy of our book, just read below the video. You can find out how to get in touch with us, text us, or call us, and be happy to answer your questions. Thanks for watching, and we'll see you on the next one. Have a great day.